Hi, my name is Dr. Melissa Carr, and I'm a doctor of traditional Chinese medicine in Vancouver, British Columbia, Canada. My main mode of treatment is acupuncture, and part of the acupuncture therapy, we will sometimes use ear acupuncture or ear seeds. So ear acupuncture is something that a practitioner would do in office, but ear seeds is something that I can teach you how to do at home. And I'm going to show you a couple of different forms of ear seeds that you could use. There are other formats out there, but these are my two preferred methods. And I have an ear model with me as well, because it's a little tricky for me to show on my ear. So basically, ear acupuncture, if you can imagine your body upside down, fetal position, the way that you're starting off in the womb. So you have the head down here, you have all the internal organs through here, you have the spine goes up through here. And so you'll see that there are different areas of the body represented on this ear. And there's even points on the back as well. Now with this mode of therapy, I usually give to my patients who I recommend that they do this at home, I'm giving the points that they are recommended to apply if they have to apply them at home. But it's not that tricky for you to do some form of therapy with this yourself. So if you, for example, know that you have an issue with your lungs, you can go to the lungs on the inside there. You can see that on the inside is the lungs. In the center there is the heart. And so you can apply a point, an ear seed onto the lungs. And I'm going to show you the ear seeds in just a moment here. If you know that you have a problem with your hip, you can go to the hip, the knee. So knowing where your issue is, you can apply an ear seed on that spot related to the location. On here, you can apply a seed there. What the seed does, and I'll show you the two main formats that I have. So the general one here is looks like this. Okay, so this is actually a seed. The seed in Chinese medicine is called Wangbu Lu Xin, and Wangbu Lu Xin is a tiny little seed that is good for, it's a blood mover in Chinese herbal medicine. So we will sometimes, this will be part of a formula that's taken internally. But for this purpose, it works, it's a very nice size to be able to apply pressure to a point. And so if I want to put a particular point, for example, so I would just use my fingers there, but you can, I do recommend you use tweezers as well for yourself. One, it makes it so that you're not having so much of your own finger on the back of the sticker, makes it easier to apply. So you can, it's a little tricky in this format here where I can't see it very well, but basically you can apply it with a mirror or somebody else, put it onto the spot and stick it down. Okay, and what this does is this tiny little seed here will apply, it will create a little bit of a pressure point. So when I squeeze that, I can feel where the seed is, and I'm applying pressure onto that specific point of the ear. So in this case, if I were to do Shenmen is a really common point. So often this is a starting point for where people will put it. Shenmen means spirit gate. It's a really good point for calming the nervous system. And I'm going to show you in this ear here, the point that I did do with another kind of ear seed. So this one here is on Shenmen, and it is a crystal. So in this case, it's a Swarovski crystal, different colors in this one, or plain regular white ones as well. And what these ones have on them is on the back of these stickers, there's a little 24 karat coated gold ball. So this is a metal ball that applies, that is the pressure point, so an alternative to the seed. And what you do is you leave them on, you leave these points on for anywhere between 3 to 7 days, and you occasionally press it. So if I feel, in the case of this one, I feel I'm a little bit stressed out, I'm having a hard time sleeping, that kind of thing, I could press that point for a little bit, make it a little bit sore. You're not pressing it too hard, just you're going to apply a little bit pressure. It'll feel a little bit tender, and you're going to be recommended to do that a few times a day. You can do it more often if you want, but just apply a little bit of pressure to it. I do have, sometimes I'll recommend people put it on both sides, bilateral, but if you have a side that you tend to sleep on and it's bothering you, then you can just take it out of the one ear or any of the points that are bothering you, peel them off, throw them in the garbage, and don't worry about them, and leave them in the other side. So very easy to use. A couple of options. These are things that I am sending my patients when I want them to do home therapy. If you have any questions, feel free to let me know. Again, my name is Dr. Melissa Carr, and I'm a doctor of traditional Chinese medicine in Vancouver, BC, Canada. And my website is www.activetcm.com. Happy to answer any questions if you have any. Thank you.